There is a handful of surgical approaches used today by orthopedic surgeons to approach the knee. One of the most commonly used surgical technique or surgical approach is to cut the quadriceps tendon, which is a main tendon of the knee. This gives the surgeon excellent exposure to place the components safely. However, it compromises the patient's early recovery. It delays his ability to be able to perform a straight leg raise and therefore delays his ability to walk and mobilize in general. There is another surgical technique where the surgeon cuts one of the main muscles of the knee, and that has its own downsides. The technique that we've developed preserves all the muscles and tendons around the knee, yet it still gives the surgeon excellent exposure to place the components in the correct orientation. When this technique is combined with a pain-reducing protocol and a rapid recovery accelerated physical therapy program, we have seen some unique results. Patients are able to walk immediately after surgery with minimal pain. They walk unassisted, independently, and that's why we can send these patients home the same day.
It looks great. Yeah, he's good. He's getting close to 120 as well, if not more. Yeah. You're gonna run me out of a job, doctor.
Okay, thank you very much. Thank you. Thank you.
من خلال الخروج من المستشفى.
They go back to their normal activities and pre-arthritic baseline in a couple of weeks. Most patients in 3 weeks are back to work. This is a major change from the traditional knee replacement where patients are in the hospital for several days, if not a week. They're in severe pain for several weeks, up to 3 months sometimes, and recovery can be delayed to up to 3 months, if not 6 months.
We came here 5th of July. 6th of July, we went to the hospital, to Sahara Bush Hospital. We early morning, and I think we start my operation a little bit late at around 9 o'clock maybe, or 9:30. And after 2 hours of my surgery, they took me to do the physical therapy. Then I left the hospital around 1 o'clock.
Once the spinal wears off, the nurse in the recovery room calls the physical therapist and they start mobilizing the patient. Fortunately, we have had no issues with patients having any pain. I mean, most of the patients rate their pain at 10 being severe pain, 2 if not 0 out of 10, and therefore they mobilize comfortably, independently, unassisted.
You know, I walk from my room until my car, walking was Dr. Sartawi beside me and my son also and some friend with me until I got left the hospital.
Patients need to be working with physical therapy who will be pushing on their knee. So I want them to be comfortable in order to regain the range of motion, because the range of motion they gain in the first few weeks of surgery influences the longevity of the knee and how they function long term.
مرحبتين طال عمرك. بعد أسبوعين من العملية. ما شاء الله ما شاء الله ما شاء الله تبارك.
The perception from the traditional way that total knee replacements have been done is that this is a frightening operation because of the pain, the severe pain patients are in. So to them, they've had a family member who's gone through the traditional way of a knee replacement, and it's their biggest fear to experience the pain after surgery.
My brothers, I have 3 brothers, they had this both knee, and they couldn't walk before a month. They have a lot of pain, even they couldn't make their physical therapy because there is a lot of pain. It is different than my surgery. I did that surgery, the physical therapy in the same day.
So once they experience this, I think they're very satisfied, they're very happy about it, which makes us obviously very happy too.